Welcome everyone to Crenessity. I want to welcome the over 100 participants who registered for the webinar. We're going to hear clinical insights and have some Q&A with Dr. Alejandro Diaz. Just going to review the program. My name is Dina Matos. I'm the Executive Director of CARES Foundation. And we are going to hear about Crenessity from Dr. Diaz. He will do an overview of congenital adrenal hyperplasia, background information on Crenessity, overview of Crenessity's mechanism of action, and findings and significance of phase 3 clinical trials of Crenessity. We will also hear from Paige Cloke, who's the Associate Director for Patient Services, about Neurocrine's Access Support. And then this is meant to be an interactive session, so we will have Q&A with Dr. Diaz and answer questions from the audience. I have some disclosures. This presentation is intended for educational purposes only and is not medical advice for any particular patient. Patients should refer all questions about their healthcare and treatment to their healthcare provider. The speaker is presenting on behalf of and is a paid consultant for Neurocrine Biosciences. The information presented is consistent with FDA guidelines. Welcome, Dr. Diaz. Dr. Diaz is the chief of the Division of Pediatric Endocrinology at Nicklaus Children's Pediatric Specialist in Miami, Florida. He's also the medical director of the CARES Comprehensive Care Center at Nicklaus Children's and a member of the CARES Foundation Scientific and Medical Advisory Board. Welcome, Dr. Diaz.
Thank you, Dina, for that introduction, and thank you for Neurocrine to allow me to present for them. This is a very interesting medication. We first need to talk about the safety of information. Crenessity is a prescription medicine used together with glucocorticoids to control androgen levels in adults and children older than 4 years with classic congenital adrenal hyperplasia. It's very important always to remember that if you have any allergy to crinecerfont or any of the ingredients of Crenessity, you shouldn't take Crenessity. Then let's talk first about CAH, congenital adrenal hyperplasia. Therefore, we can understand the condition and then talk about the medication. Then remember that the adrenal gland produces three types of hormones that are very important for the body. The first one is cortisol, that is the hormone that controls stress and metabolism. It's very important to increase glucose levels, sugar levels in the body to have energy. Aldosterone is another very important hormone that controls water and salt in the body to have the balance. And androgens that are very important for growth, puberty, and reproduction. These three types of hormones are produced in the adrenal gland, and the balance is the one that we need to have a healthy life. Then, in congenital adrenal hyperplasia, the adrenal gland produces too little cortisol, and in 3/4 of them, 70% of the patients with classic CAH don't produce enough aldosterone to have normal levels of salt in the body. Then, too little cortisol, too little aldosterone, and because of the pathways that produce cortisol are not working, the body produces a lot of androgens. And the androgens are going to produce some of the effects of CAH that are problematic. Then if we don't treat this hormone imbalance, we can have long-term consequences. Then the symptoms with people with CAH are related to low cortisol levels or to excess androgens. Then the low cortisol levels are going to make the person feel tired, fatigued, sometimes nauseated, sometimes vomits, abdominal pain, and if they are not managed well, they can have an adrenal crisis. The symptoms related to excess androgens, children are going to have early puberty, adults are going to have fertility issues, everyone will have a lot of body hair, acne, and some mental health challenges. Then, something very important for every person with congenital adrenal hyperplasia is to be prepared for an adrenal crisis. And the adrenal crisis occurs when the body doesn't produce enough aldosterone and cortisol. Cortisol is very important, again, to keep the blood pressure normal, to keep the glucose or sugar levels normal in the body, and aldosterone to control the salt of the body. Then the adrenal crisis can be life-threatening. Therefore, it's very important to be prepared. And you should work with your doctor to create a stress dose plan in case of injury or illness. And every person should know that if you have fever, you should take a stress dose of medication. And that should be discussed with your doctor. Every person should have extra steroids to be used in case of emergency. And everyone should have the injection of hydrocortisone in case of the person having a crisis or symptoms and unable to eat. For example, when you have vomiting, nausea, unconsciousness, or seizures, that person should receive the shot of hydrocortisone and be taken to the hospital or call emergency services. Every person with CAH should have a medical alert stating that the patient has adrenal insufficiency and should have the medical contact, the contact person in that information in that medical alert, and be sure that it mentions that the person is taking steroids. And every person with CAH should have everyone living close to them educated about how to manage an adrenal crisis. Then when my patients go to college, for example, I always train them and tell them to train their classmates, roommates, closer people to them in college, or if the child has a nanny or at schools, everyone should know how to use hydrocortisone injections in case of an adrenal crisis, and that's very important. Then what is the signs of CAH? And basically CAH is a rare condition, affects the classic form affects more or less 1 in 16,000 people. The non-classic form, that is the mild form, is more common, but we're going to talk about classic form because it's what the medication is used for. And the classic form has two types: salt wasters, 70% of the patients, and simple virilizers, who are 30% of the patients. Then if the person is unable to produce cortisol, the body is going to produce a lot of ACTH. And ACTH is a signal from the pituitary gland, is the hormone that stimulates the adrenal glands to produce cortisol and androgens. Androgens, such as testosterone, are hormones that regulate growth and reproduction. But if you have too much androgens, you're going to have too much hair, acne, changes in the voice, some fertility issues later in life. Androstenedione is an androgen, and it's one of the two androgens that we measure in blood to determine how the control of the person with CAH is going on. Then based on the androgen and 17-hydroxyprogesterone levels, we determine what dose of hydrocortisone, prednisone, or dexamethasone the patient needs to take. And it varies, it's different according to age and pubertal status. And also it changes during life. But we have normal standards to know what levels should be followed according to the age and puberty. Then the body has something called the hypothalamic pituitary axis, and it's made from three parts. First one, the hypothalamus, that is in the brain, and that controls a lot of things, including temperature, hunger, but produces signals that go to the pituitary gland, and the pituitary gland produces some very important hormones. Among those is ACTH, is the hormone that stimulates the production of cortisol in the adrenal gland. Then ACTH through the blood goes to the adrenal gland, and the adrenal gland produces cortisol, aldosterone, and androgens with the stimulation of ACTH. Then CRF is the hormone produced in the hypothalamus, is the hormone that stimulates the production of ACTH from the hypothalamus. And CRF binds the CRF1 receptor in the pituitary gland, and the pituitary gland produces ACTH. And ACTH, as I mentioned, goes through the adrenal glands to produce cortisol. Then if the production of cortisol is low, then the levels of CRF and ACTH are going to be high. If the body has enough cortisol, the normal production of cortisol, then the levels of CRF and ACTH are going to go down. And these levels change throughout the day. For example, very early morning, after 3, 4, 5 o'clock in the morning, the body produces more CRF, more ACTH. And when we wake up, we produce a peak of cortisol. In patients with CAH, because they cannot produce cortisol, those levels of CRF and ACTH are going to be very high, and they're going to stimulate the production of androgens mainly. Then let's talk about Crenessity. Crenessity, crinecerfont, is a groundbreaking treatment approach for classic CAH. It's a prescription medicine used together with glucocorticoids, steroids, to control androgens, testosterone-like hormones, in adults and children older than 4 years with congenital adrenal hyperplasia, classic congenital adrenal hyperplasia. And if you have any allergy to crinecerfont or any of the ingredients related to Crenessity, you shouldn't take it. Then managing CAH with steroids alone is challenging. And this is what we have been using for many, many years, for 70 years. And it's challenging because we want to replace the cortisol that the body is not producing. Then those usually are determined dose in most people, a determined amounts in most people. But we also want to decrease or to keep the androgen levels within the normal limits. And the problem is that to maintain those levels of androgens within the normal limits, we used to use more cortisol or steroids than the body needs. Then those higher doses of steroids can have some problems, can be some consequences in our body. Therefore, to be able to find that balance is very complex. To have more, to take more steroids than needed in a normal situation to maintain the androgens lower. Then, when we use too much steroids, we're going to have obesity, diabetes, low bone density, osteoporosis, anxiety, depression, problems with memory, high cholesterol, high blood pressure, and some problems in the heart. When we take too little steroids, then we're going to have high androgens and high ACTH. If they have too much androgens, the bones are going to close early. Therefore, they're going to grow very fast, but they're going to stop growing. Girls or women with high androgens have irregular periods. Sometimes they don't have periods until you are able to control the androgens well. They're going to have some fertility problems. Hirsutism, that is excessive hair growth in face, in certain areas that are uncomfortable to have. Acne. Sometimes you have some mental conditions. And males, and also females, because the ovaries and the testicles are formed in utero in the same area of the adrenal glands, there are going to be some pieces of the adrenal gland that are going to be in the ovaries and in the testicles, those called adrenal rests. And if we don't control very well the condition, then those adrenal rests are going to make the testicles, are going to affect the function of the testicles and ovaries. Then we see that a lot of people, males that are not well controlled with steroids, they have this, we call it TARTs, testicular adrenal rests. And those can produce problems in fertility in the future. But when we do higher doses of steroids to be able to keep the androgens low, then high doses of steroids can produce obesity, diabetes, osteoporosis, that is low bone density, anxiety, depression, some memory issues, high cholesterol, high blood pressure, and heart disease. Then to be able to control, to have this balance is very difficult. Based on 2 studies, we see that 2 out of 3 people with CAH have poorly managed androgen levels. And we see over and over that though sometimes the androgens are elevated, the dose of steroids is also high. There are another study showing that 1 out of 3 adults with CAH already have complications associated with high doses of steroids. Then, Crenessity has been a groundbreaking approach to classic CAH because it's the first ever FDA-approved medication for the treatment of classic CAH. And Crenessity is not steroid, improves androgen control, and also allows us to use lower doses of steroids to control the condition. Remember that it's not to treat cortisol insufficiency. Steroids always need to be used. We cannot stop the steroids. Then, why Crenessity is so important? Because we can use lower doses of steroids. We can improve androgen control with lower doses of steroids, and it's administered twice a day. Something very important, because it happened to one of my patients, is that Crenessity needs to be taken with food. Don't forget that. Don't forget that, because my child, I have a few patients, a good number of patients on Crenessity, and this child came a month later, and I look at his levels of 17-OHP and androstenedione, and they weren't changed. Then when I asked the family to come to my office and have a conversation, though I told them that you need to be taking with medication, with food, the family said, okay, doctors always tell us take the medication with food, and we really don't believe that was important. But once they started taking the medication with food, therefore it's something that it needs to be remembered. It needs to be food, and that food needs to have some fat. And if you drink low-fat milk, it's not going to work that well. Then the beauty of Crenessity is that we already, with the two studies that I'm going to discuss, have shown that have a very positive safety profile. In adults, the side effects more commonly seen were tiredness, headaches, dizziness, joint pain, back pain, decreased appetite, and muscle pain. Those symptoms are related in general to adrenal insufficiency. And what we see is that if you stop or decrease the steroids too fast, then you can have some side effects like these ones, but also the medication per se can be related to that. In children, we saw headaches, stomach pain, tiredness, nasal congestion, and nosebleeds. And most side effects were temporary and mild to moderate in severity. The clinical study program was the largest, most extensive exploration of a treatment for classic CAH, and included a diverse group of children, teens, and adults aged 4 and older. And something very important to remember is that the support of Crenessity is fantastic. It has been the experience with my patients. We have one-to-one personalized support. Neurocrine Access Support is free. It's a free comprehensive program to help you fill your prescription, answer your questions, and find financial support to help pay for Crenessity. Then here we have examples of patients with CAH. These are not real people, but something that happens in our practices. Emily is a 9-year-old girl with CAH. The mother is very worried about early puberty, excess hair due to high androgens, and she also feels uncomfortable that Emily is going to feel different than her peers. She's on hydrocortisone 3 times a day for a total dose of 17.5 milligrams. Her androstenedione is elevated, 150 nanograms per deciliter. Steven is a 19-year-old with CAH, and he felt self-conscious about acne, worries about the TARTs, infertility, if the ACTH and androgens are not well controlled. He's on prednisone twice a day for a dose of 7 milligrams, and the androstenedione is also elevated, 350 nanograms per deciliter. Kyle is a 10-year-old with CAH, and Kyle's the mother is worried about the symptoms of excess androgens, such as early puberty, acne, excessive hair, and she also doesn't want her to feel different than her peers. And she's on hydrocortisone, 20 milligrams divided 3 times a day. And the androstenedione is elevated, 150 nanograms per deciliter. Jasmine is a 28-year-old with CAH, and she has been thinking about her future and wonders if the high androgens are going to affect her fertility. And she's on hydrocortisone 3 times a day for a total daily dose of 32 milligrams. The androstenedione is also elevated, 450 nanograms per deciliter. Patrick is a 38-year-old with CAH. He has problems managing his weight. He has prediabetes, and he's worried about the long-term consequences of high-dose steroids, developing full-blown diabetes. He's on dexamethasone once a day, 0.5 milligrams, and the androstenedione is within the range, 185 nanograms per deciliter. Amy is a 52-year-old with CAH, and she has struggles for years with osteoporosis, weight gain, high cholesterol, and the doctor really believes that it's related to the high doses of steroids. Then the androstenedione in her case is within range. These are cases that we see in our practices, and it's a good representation of the fears and the levels and the difficulties that we have managing optimal levels with the steroids. Then Crenessity has some ambassadors that I would like to share the experience about their life using Crenessity with you, and then you can have access here. Susan, Grant, and his mother, Christy, Paul, Liam, Lauren, and Valerie and Ryan. This is very important if you want to have direct information about the experience on some individuals using Crenessity. Then I need to read this slide, very important. Symptoms of an allergic reaction includes tightness of the throat, trouble breathing or swallowing, swelling of the lips, tongue, or face, and rash are those symptoms of allergic reaction to Crenessity. You need to get immediate medical help and stop taking Crenessity. Risk of sudden adrenal insufficiency or adrenal crisis with too little glucocorticoids can happen. Then it's very important always to remember that you need to continue taking steroids because people with CAH can have, are not taking enough steroids, can have an adrenal crisis or adrenal insufficiency. You should continue taking your glucocorticoids medications during treatment with Crenessity. And certain conditions, I always mention that, the stress dose, as infection, severity, or shock may increase your risk for sudden adrenal insufficiency and adrenal crisis. And always tell your healthcare provider if you get a severe injury, infection, illness, to have plans or plan surgery, to have your plan for the doses of steroids. And every patient who comes to my office goes with a letter, and the letter states the condition. I said, if the fever is between this and that, you take this amount of medication, more than this fever, this amount of medication. If you have vomiting, unconsciousness, seizures, then the injection of hydrocortisone needs to be injected and go to the closest emergency hospital. Then this is the most important thing for me, and I see sometimes that patients are not so well trained in their adrenal insufficiency or crisis, and they need to have with you always the hydrocortisone injection. Then what is the mechanism of action of Crenessity? Basically, remember the signaling. CRF is produced in the hypothalamus, and it goes to the pituitary gland. The pituitary gland produces ACTH that goes to the adrenal glands and produces stimulation of the production of cortisol. In CAH, because we don't produce cortisol, enough cortisol, the CRF and ACTH are going to be very high, and all that pathway is going to go to produce more androgens. Then what Crenessity does is blocks the receptor for CRF in the pituitary. It binds to the receptor and inhibits the function of that receptor. Therefore, the person is going to produce less ACTH. And if we produce less ACTH, you're going to produce less androgens. Then you will be able to replace the steroids at the correct dose, not higher, because you don't need to decrease the androgens only with the steroid. And that's a big, big, big thing. Here is the process. The Crenessity binds to the CRF receptor, the pituitary, interrupts the signaling of CRF, and therefore we're going to have, we already don't produce, or they don't produce cortisol, you don't produce cortisol, then it doesn't matter, but it matters is that you are going to be able to have lower levels of androgens. Then, this is the most important information. There were 2 clinical trials to prove and to demonstrate how it works and in real people. Then there were 2 studies. One was a pediatric study with 103 participants, and the other was an adult study with 182 participants. And those studies were designed to address the priorities of people with CAH, and they tested how Crenessity can lower androgens, lower steroid dose, or both. Then there were, in the adult arm of the study, there were 182 participants older than 18 years. At the start of the study, all the participants were taking hydrocortisone, prednisone, or dexamethasone, and a greater dose than the one needed for normal replacement. We call physiological replacement. That's the amount of cortisol or steroids that you need to give what your body only needs. But remember that in CAH, you need extra. Then these people in this study, they were taking doses we call supraphysiologic, more than the body normally needs. Then 122 of them took Crenessity and 62 placebo. Remember that placebo is a substance that doesn't have any effect in the body. But because we always have a psychological effect taking any medication, then we use placebo. In that way, the person doesn't know if he's taking the medication or the placebo, and the study is going to be clean. We cannot say that it's because the person knew they was taking a medication, the medication had good results. Then, through the study, both groups took enough steroid medication to ensure that they were within or above the range needed to replace cortisol. Something very important, I had patients that had low levels of androstenedione and 17-hydroxyprogesterone, and I never go below the physiologic dose despite the low levels of 17-hydroxyprogesterone or androstenedione because it's not safe. Then we need to give at least the minimum amount that the body normally needs of steroids. And these patients were followed for a period of 24 weeks taking Crenessity or the placebo. Then what we saw in those patients is that androstenedione, we also know that as A4 because in the studies they mentioned A4 androstenedione. They were able to decrease 8 times the levels of androstenedione compared to placebo when they were taking Crenessity. That was significant improvement. But the good part is that there was a significant decrease on the androstenedione levels, but also the dose of steroids were decreased twice compared to the placebo group. Then the levels were reduced by almost 300 nanograms per deciliter in adults taking Crenessity at 24 weeks of treatment, 299 versus 46 in those taking placebo. And adults taking treated with Crenessity were able to reduce steroid by 27% from the beginning of the study, compared with 10% for the placebo after 24 weeks. Then this was a very, very nice study showing how effective the medication is in real life. Then the safety profile, as I mentioned before, the most common side effects were tiredness, headaches, dizziness, joint pain, back pain, decreased appetite, and muscle aches. Then most of the side effects were temporary and mild to moderate in severity. And 96% of patients taking Crenessity completed the 24-week study. I mean, it was a very good compliance. Remember that adrenal insufficiency and crisis are risks of living with CAH that Crenessity does not address, and they can occur when your steroid dose is too low. And I repeat that over and over and over. You need to always take the steroids. Don't go below the physiologic dose. In the adult clinical trial, 2 patients taking Crenessity experienced adrenal crisis. No patient on placebo experienced adrenal crisis. However, 1 did experience adrenal insufficiency. And please talk to your doctor about how to manage your steroid doses while taking Crenessity. Then the pediatric study, they treated 103 patients between 4 and 17 years of age with classic CAH. At the start of the study, everyone was taking supraphysiologic doses of steroids. 69 took Crenessity and 34 took placebo. And throughout the study, both groups took enough steroid medication to ensure that they were within or above the needed for replacement of cortisol. Then the study lasted 28 weeks, comparing placebo with treatment, and we saw a reduction of 4 times the levels of androstenedione in those patients taking Crenessity compared to placebo, and the reduction of steroids was 4 times that one that observed in the patients taking placebo. Then the levels of androstenedione decreased from 197, were reduced by 197 nanograms per deciliter in the group taking Crenessity, compared to an increase of 71 nanograms per deciliter those taking the placebo at 28 weeks. And children with Crenessity were able to reduce the steroid dose by 18% compared to an increase of 6% on those taking the placebo. Then this is also very important results. The study, the steroids were adjusted by the doctor. It's called PI, the doctor taking care of the study. No children taking Crenessity have experienced adrenal crisis during the study. And remember always that cortisol, hydrocortisone steroids need to be taken when you are taking Crenessity. After the placebo period of the study ended, 97 of the 103 children continued the study with all participants taking Crenessity. Then they moved from those placebo and everyone was placed in Crenessity and they were followed over time. The side effects more commonly observed in children were headaches, stomach pain, tiredness, nasal congestion, and nosebleeds. Most side effects were temporary and mild to moderate in severity. And 100% of children taking Crenessity completed the 28-week study. That's very important. No one left the study. As I mentioned before, the adrenal insufficiency and crisis are risks that Crenessity doesn't address, and it can happen when you are taking too little steroids. And the most common side effects, again, in adults, tiredness, headaches, dizziness, joint pain, back pain, decreased appetite, muscle ache. In children were headaches, stomach pains, tiredness, nasal congestion. And most of these were temporary and mild to moderate in severity. Then this is about the dosage of Crenessity. Crenessity is a capsule taken by mouth twice a day, the morning and evening meals, glass of whole milk. Remember that it's very important to have food to absorb the medication. All adults taking age 18 or older take 100 milligrams twice a day, the capsule. The dose is based on weight. When the weight is 22 to 44 pounds, then it's 25 milligrams twice a day. 44 to 121 pounds is 50 milligrams twice a day. And above 121 pounds, all adults take 100 milligrams twice a day. And in case of missing a dose, take another dose as soon as possible, even if that means taking 2 doses together. And then you resume your regular dosage. Then you should talk to your doctor about Crenessity, exactly as your doctor. And when you take it, you need to follow the directions that the doctor is telling you what to do, and remember the stress dose and the modifications of the dosage of the medication is going to happen after treatment. Then Crenessity doesn't treat cortisol insufficiency. Steroids are needed. I'm going to repeat this over and over because it's very important. Talk to your doctor about a plan to reduce your steroid dose over time and make sure they continue the stress dose when needed. The laboratory values and clinical symptoms will help your doctor guide for the steroid reduction. You need to wait for the numbers to be there, present, seen by your doctor to know what changes are going to be done. And talk to your doctor about what to expect, how to feel, you or your child, in the process of adjusting the dose of Crenessity. Then this is important here. Almost 4 out of 10 adults taking Crenessity and hydrocortisone were able to take fewer doses of hydrocortisone each day compared to 1 in 10 taking placebo. This is very important. And most people were able to decrease the dose of steroids, maintaining better levels of androgens. Nearly 9 out of 10 adults taking Crenessity and dexamethasone were able to switch to dexamethasone-free regimen compared to 4 out of 10 taking placebo. Remember that of the steroids, we prefer to use hydrocortisone. Dexamethasone is a long-acting, very strong steroid, and it's better in general to use hydrocortisone than dexamethasone. About prednisone, again, is in the middle, but prednisone is better than dexamethasone. Something that you can discuss with your doctor if you are taking dexamethasone. But 3 out of 10 adults taking Crenessity were able to switch the steroid from prednisone to hydrocortisone compared to 1 in 10 taking placebo. Again, the ideal one, because it's the physiologic, the one the body produces hydrocortisone. Prednisone and dexamethasone are stronger and longer half-lives. The majority of children taking Crenessity were able to lower the dose. Almost 3 out of 5 children taking Crenessity in the study were able to lower the steroid dose by 2.5 milligrams per square meter per day to the cortisol replacement range while maintaining or improving androgen levels from when they started the study. Then this is quite significant because 2.5 milligrams per square meter per day makes you closer to the physiologic range. And almost 3 of 5 taking Crenessity, 38 of 67 children in Crenessity, total 3% of them achieve the same endpoint. And we saw that 30% of children taking Crenessity achieve cortisol replacement dose, but not children taking placebo. Again, they were able to, the physiologic, the ideal one was achieving 30% of the kids taking the Crenessity versus no one taking the placebo. Then, again, safety information is very important. I'm going to read the slide. Before taking Crenessity, tell your healthcare provider about all your medical conditions, including if you are pregnant or plan to become pregnant, or are breastfeeding or plan to breastfeed. Tell your healthcare provider about all the medications that you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. The most common side effects in adults were tiredness, headaches, dizziness, joint pain, back pain, decreased appetite, and muscle aches. The most common side effects of Crenessity in children included headaches, stomach pain, tiredness, nasal congestion, nosebleeds. There are no all the possible side effects. These are not all the possible side effects of Crenessity. However, these were the most common ones. And if you have any of them, you need to call your healthcare provider for medical advice about the side effects, and you are encouraged to report any negative side effects of prescription drugs to the FDA. And this is the place, the phone number, the website. Crenessity is available in 50 milligrams and 100 milligrams capsules, and oral solution of 50 milligrams per milliliter. Now we're going to talk about Neurocrine Access Support for Crenessity.
Hi, everyone. My name is Paige Cloke. I am the Associate Director of Patient Support Services at Neurocrine, and I get to spend a little bit of time with you telling you about our robust support program for Crenessity. If you want to go to the next slide, Dr. Diaz, thank you. So I wanted to start with just telling you and sharing with you our core mission statement that anchors my work day in and day out at Neurocrine. Neurocrine Access Support for Crenessity, our goal is to simplify access for you. Our goal is to provide dedicated support personalized to you. How we do that is through helping patients and caregivers overcome barriers to access and affordability through a comprehensive suite of programs that allow patients to get started on Crenessity quickly and remain on therapy throughout any coverage situation. If you want to go to the next slide, Dr. Diaz, I'm going to tell you a little bit how we do that. I want you to understand how the program works and why we're here to support you. We know that starting a new medication can come up with a lot of unknowns. With Neurocrine Access Support, you can count on us to provide you the support that you deserve with a dedicated team that's just a phone call away. Our dedicated team is managed by the Crenessity Pharmacy, which is provided through a specialty pharmacy called Panther X Rare. For those who don't know what specialty pharmacies are, they're a little bit different than the pharmacies that you may see at Target. It's because that they offer personalized support through many rare conditions, and they provide medication and other services required for individuals for a successful treatment experience. Your Crenessity pharmacy at Panther has specific experience in CAH. Their clinicians are trained in CAH. They know what it is, and they are a partner with you to manage your health needs. They do that, if you don't mind going back, sorry, Dr. Diaz, they do that through the care coordinators. And the care coordinators are your partner for one-to-one dedicated support. So, once your provider writes a prescription for Crenessity, you will get a call from your care coordinator. And your care coordinator is there to help both caretakers of children and individuals navigate your Crenessity journey. They will talk to you and explain what happens next. There's a couple different ways that the care coordinator can help. What they will do is they'll help you navigate your insurance or any financial assistant options for you. They'll have a conversation, see what's going on. They also will help you coordinate your medication that conveniently gets delivered right to your doorstep. And for future medication deliveries, you can actually coordinate that over text message. So you don't necessarily have to pick up the phone every month. They will also connect you to the right resources. So if you have a question, they will point you in the right direction. They are your CAH knowledge experts. Next slide, please. So I just overviewed how the program is organized and how we've thoughtfully worked with Panther Rare to create Neurocrine Access Support in your experience. The next piece I want to tell you about is the suite of program services that we have through Neurocrine Access Support. Our goal is, no matter your situation, we are here for you. And here I'm going to tell you a little bit about these 4 different boxes and how they will hopefully capture you in every step of the way. So first of all, before we even get started, I wanted to just share that, did you know 9 out of 10 people taking Crenessity actually pay $10 or less per month for their copay? And in fact, most individuals only pay $0, so they don't pay at all. The Crenessity Savings Program is here just to orchestrate that. If you have commercial insurance, our copay savings program will be applied automatically. You don't have to ask for it. The next program that we have is actually to help patients quickly start Crenessity. So we are basically committed to helping you start Crenessity as soon as possible. You may receive up to 30 days free of Crenessity if there's any coverage delay in getting your insurance to initially cover Crenessity. Additionally, we have a program to support those who may not have insurance or whose insurance doesn't cover Crenessity, or you just lack the financial resources to pay even if your insurance does cover Crenessity. And that's called the Patient Assistance Program. And that, again, is designed for you, and your care coordinator will help you navigate that when relevant. And then lastly, I know that I personally have experienced changes of insurance when my husband and I started new jobs last year. It's a really common thing that happens to individuals. And so we've created a program that helps you continue access to Crenessity to help bridge that gap when you are experiencing a change. That said, if you are currently on Crenessity or you plan to have a change of insurance, you need to let your care coordinator know so they can get ahead of that and help bridge that gap as soon as possible. Dr. Diaz, do you mind going to the next slide, please? So are you good?
Yes, I'm good.
Okay, cool. So the last bit is I wanted to share with you some resources. These resources essentially review everything I just talked about, but it gives you time to digest them. So you can scan that QR code and it will take you to our website. It will review our program services for you. You can dig a little bit more into them. And then it also gives you some helpful links that are beyond just Neurocrine Access Support. Overall, Neurocrine Access Support is here to support you. We're extremely proud of the program that we've created, and we hope that you have a wonderful experience engaging with our care coordinators and navigating through your journey on Crenessity. I believe that I'm passing the torch over to Dina.
Thank you, Paige. Oh, first of all, thank you, Dr. Diaz, for
Thank you.
that excellent presentation. I think, we learned lots about Crenessity and the studies. I hope everyone learned as much as I did. I know I've been around for a while, but I always learned something new. And Paige, thank you so much for sharing that information. I will tell you that the reports that we receive on a daily basis about the access support and the patient assistance program has been outstanding. So thank you for what you do and what your team does.
That's awesome to hear.
As I said earlier, when we started, this is meant to be an interactive session. So we want to thank those of you who submitted questions in advance. And then we are going to try to answer as many live questions as we can. So here we go. This is a question for Paige. If this medicine is not on the covered list for my insurance, what options do we have for payment assistance?
Yeah, so that's a great question. First of all, I always say the best place to start is to have your provider submit a prescription to Neurocrine Access Support. They will help you navigate through all of the programs that I just went over and assess your eligibility. If you, at the end of the day, your insurance is still not covering, and you have, denials on file, you'll be assessed for the patient assistance program. So high level, go to Neurocrine Access Support and they will help you.
So here's another question about insurance. Does insurance widely cover this with it being so new?
Yeah, so we actually have some facts from our program already that I can share with you. Roughly 9 out of 10 patients are covered through their insurance for Crenessity. And again, just to reiterate, also 9 out of 10 patients pay $10 or less for Crenessity. So there's coverage and affordability paired together. And again, we have a trained pharmacy who can help your provider navigate the insurance barriers for you so you don't have to worry about that.
Thank you. Another question for Paige. Is there anything to offset the cost? What is the cost of medication without insurance?
So 9 out of 10 patients pay $10 or less. Many pay $0 or less. And as I reviewed just a few minutes ago, you have a lot of programs that are here to robustly cover you throughout your journey, no matter where you are.
And if I can just add to what Paige said, we talk to a lot of patients and have since Crenessity has been approved. And every patient that we've interacted with who has gotten a prescription for Crenessity has been able to access the medication whether insurance covered it or not. And again, because of that robust patient assistance program. Question for Dr. Diaz. Are patients on Crenessity able to decrease intake of their steroid?
Yes, and that's the reason why we want to use the medication. And I have a good number of patients on Crenessity, and people are so excited about decreasing the steroids that I always check the levels. I mean, 1 month later, that's the time that was recommended. And what I see is a significant decrease of the 17-hydroxyprogesterone and androstenedione levels. And then I'm able to go down to a little bit. My first experience is that I went to physiologic dose. I was so excited when I saw the good results. I went right away to physiologic dose, but some kids felt tired. And what I decided is to decrease maybe 30% the dose. I'm not in a rush. As I tell the parents, the child has been taking steroids for many years or some years. Then I'm not in a rush to go to physiologic dose right away. What I do now is, for example, if they are taking 16 or 17 milligrams per square meter per day, I go to 13 or 14. And then if they are taking 14, I can go to 12. I don't rush the decreasing the dose. And what I see is that even with the lower dose, I can keep going lower. Then what I like the most about Crenessity is that I can use the physiologic timing of the administration of the medication. What do I mean with that? Most pediatric endocrinologists or endocrinologists use 3 doses of steroids, 1 dose of medium size in the morning, 1 dose lower in noontime or early afternoon, and we try to do a high dose as late as possible at night. Why do we do that? Because if we do the high dose, very late at night, we're gonna decrease the raise of 17 OHP and androstenedione early morning. The most endocrinologists do that, but some do a higher dose in the morning. However, when I use Crenessity, I can do a higher dose in the morning, a lower dose at noontime or early afternoon, and a low dose at dinner time. That's the way is recommended to treat people with central adrenal insufficiency. That's the physiologic way. That's the way the body works. The body produces a higher dose early morning. It produces a few ones extra, but the classic one is the higher dose early morning. There is an increased levels at noontime and increased levels at dinner time. Then when I use Crenessity, I can stop doing that high dose at late night. That is not normal. You don't produce a high dose of cortisol late night, and that can affect the quality of your sleep, can make you gain weight. And then once I go to the normal way to treat steroids, that really means a lot. And even better, that I can use a lower dose of steroids.
Thank you. Here's a simple question. Why start at age 4?
The study was designed to do it between 2 years. You remember that everything is based on a study. The study that I presented, supposed to be between 2 years and 17 years, but there were no kids recruited younger than 4. And the youngest kids recruited for the study were 4 years old. Therefore, the data that we have for safety, for results, started at 4. That's the reason why the number is 4.
Because the FDA approved it based on the
On the studies.
study.
On the studies.
Great. Okay, another question. Explain in detail androgens and cortisol and how CAH affects both.
Okay. In detail, that's a good question. And basically, we produce cortisol. Cortisol is the stress hormone. Then when we were in Africa many years ago, when we saw the lion coming to us, our body produced cortisol to be able to raise the levels of sugar, of glucose, and to have energy to run. Then that's the reason why it's called the stress dose. We need cortisol to be able, in situations of we don't have lions anymore in our society, but we drive, we get sick, we get fever, we have surgery, we have accidents, and in those situations we produce cortisol to be able to increase the levels of glucose. Also, every morning, once we open our eyes, we have a peak of cortisol. Then we have a boost of cortisol that's going to produce a boost of glucose to have enough energy to start the day. And throughout the day, we're going to have other peaks of cortisol that are important, again, to maintain glucose in circulation, good energy levels, so on and so forth. But the most characteristic peak of cortisol is the one very early in the morning when we wake up. Then there is another peak that is very classic at lunchtime and another at dinner time. And that's very important for our normal metabolism. However, we don't want to have too much cortisol because cortisol, as I mentioned before, can affect the bones, can affect the heart, high blood pressure. We know all the consequences of stress in our life, and we know that most of the consequences of stress in our life are related to high cortisol levels. Then, because in CAH, we cannot produce cortisol or enough cortisol, then the system is going to try to make the adrenal gland produce more cortisol, but there is a block, and that's the 21-hydroxylase that is not working. Then I cannot make cortisol, but everything behind the 21-hydroxylase is increased because the ACTH is very high. Then all that stimulation in the adrenal gland to produce cortisol is going to go to produce androgens. Then androgens are, males and females produce androgens. We produce more androgens than women, but women also need androgens. And also estrogens, they come from androgens. Then if the levels of androgens, we are males because we have more androgens. Then when the baby's being formed in utero, by 6-7 weeks of gestational age of pregnancy, those androgens are going to make the genitalia develop as a male. And because women have less androgens, the genitalia is going to be female. Then when the fetus female or female has too much androgens, they're going to have some changes in the genitalia that are very well known. It's because the androgens are higher. Then, when the baby is born, if the baby has the soul wasting form, that is the most common one of the classic CAH, that baby doesn't produce also aldosterone, and aldosterone is extremely important to control salt and potassium in the body. Then if that baby is not diagnosed with the newborn screening, and something very worrisome is that more or less between 15 and 19% of babies with classic CAH are going to be missed by the newborn screening. If we don't make the diagnosis at that time with the newborn screening, that baby is going to go into an adrenal crisis after 1 week of life, usually. An adrenal crisis is low sodium, high potassium, low blood pressure, and that's life-threatening. And if we don't recognize that, that's very dangerous. Then that's because we don't have enough aldosterone, enough cortisol. 30%, more or less 30% of babies with classic CAH are going to be simple virilizers because they produce a little bit of the activity of the 21-hydroxylase is very mild. That's enough to produce aldosterone to control the salt levels. The salt levels that the baby is not going to have a salt wasting crisis. And that's simple virilizers versus the other one. But that high, the testosterone is going to keep high unless we use steroids. And those high androgens, 17-hydroxyprogesterone, androstenedione, the most powerful one is testosterone, are going to produce changes in the baby, boy or girl, throughout life until we are able to bring down those levels. But the price that we pay for bringing down those levels is that we are going to be using higher doses of steroids. And those highest doses of steroids control the androgens, keeping them lower, but they are higher levels than normal, that normally the body produces. Then the reason why it's so difficult to treat cases of people with CAH is because we need to find the right balance to give the right amount of steroids that's going to be usually more than we would like to try to keep those levels of androgen lowers, and that balance is very difficult to achieve. And what Crenessity is allowing us to do is to do that. And if we're able to bring down the ACTH, the levels of androgens are going to go down, and then we were able to use the right amount of cortisol to avoid all those complications of high cortisol levels. I can keep going for another hour, but I don't think I have that time.
Thank you. That was great. Here's another one. Most treatments are geared for children, and rightly so. But what would this treatment do for a CAH patient in his 70s?
Remember that 80% of women who reach the age of 80, 40% of women who reach the age of 80 are going to have fractures due to osteoporosis. 20% of males who reach the age of 80 are going to have fractures due to osteoporosis. And those are people without taking steroids, without CAH. Then even if you are 70 and you are taking higher doses of steroids, those steroids are not good for your bones, are not good for your brain, because high doses of steroids also produce cognitive decline. And remember that cognitive decline happens after 50. Then if you are taking higher dose of steroids in a critical period, like you're 70, you're going to have more weight gain, hypertension, cognitive decline, osteoporosis, and I can keep going in the list because it's long. Then it's important, I believe at any age, to use high doses of steroids is not good for your body.
So Crenessity could potentially help.
Yes, absolutely.
Thank you. Can this medication be used in salt-wasting CAH?
Yes. Yeah, then this medication is used, is recommended. The use is for classic CAH. And most patients with classic CAH are going to be salt wasters. Therefore, the most important indication for this in terms of is for salt wasting CAH, because remember that 70% versus 30%, but it's going to be used for classic, and classic is going to be both of them, simple virilizers and salt wasters. And yes, that's indication for this medication. That's when it should be used. It's not indicated for non-classic CAH. That is far more common. Non-classic is the late onset, and it's quite common, but that is not indicated for those patients yet.
So, Dr. Diaz, we still come across this. Some people are confused about what constitutes classic CAH. So, do you mind just going through?
Absolutely, absolutely. Then CAH is a group of conditions where we're unable to produce enough cortisol. And there are many pathways, many areas where there are some enzymes that produce one hormone from another hormone. Then in CAH, the most common one is 21 hydroxylase. And by far the most common one is 95% of the patients have 21 hydroxylase deficiency. Then if we don't have that enzyme that makes 17 hydroxyprogesterone into the precursor of cortisol, and androstenedione into the precursor of testosterone, that pathway is blocked, then we are going to have very high levels of 17-OHP, androstenedione, and testosterone because you are unable to cross that line. What we do is to give cortisol to be able to decrease the ACTH to bring down all those precursors. Then using hydrocortisone, cortisol, prednisone, dexamethasone, we're able to tell the brain, stop producing so much ACTH. And then if we do that, all those androgens that are producing problems are going to come down. Then there are other forms of CAH, but they are far less common. 11 hydroxylase, 17 lyase, 3 beta, but those are far less common. And again, this medication is for classic CAH and 21 hydroxylase. No one has said that classic do something different, but we assume it's for 21 hydroxylase because the other ones are far less common.
Thank you. So, how quickly will Crenessity lower 17-OHP levels?
Quickly, but the time where we are now safe to make changes, where we assume that all the changes are happening and the levels are stable, is 1 month. Then after 1 month of Crenessity is when we order the 17-OHP and the androstenedione. And I also like to check the ACTH because I want really to see how it's coming down. And then it's 1 month. In 1 month, we see results.
Thank you. Why, this is another good question. Why do you continue taking steroids with this drug?
Remember that this drug is decreasing the production of ACTH. That is the hormone that stimulates the adrenal glands to produce cortisol. But when you have CAH, you don't produce enough cortisol. In the classic form, the production of cortisol is minimal. But you produce a lot of testosterone, a lot of androgens. Then this medication blocks the stimulation to produce cortisol, but the cortisol is already very low. It's not making anything to do with the cortisol. It's just low. And I'm replacing the cortisol with hydrocortisone, prednisone, or dexamethasone. But the price that we have of having those levels so high of ACTH is that the androgens are going to be very high. Then, because I already have low levels of cortisol, I don't have a problem to decrease ACTH because it was already low. But what I'm doing with Crenessity is decreasing the production of androgens. Therefore, the cortisol needs to be given. But the beauty of Crenessity is that I don't need to give high doses of steroids of cortisol to bring down the androgens. I just give the amount of cortisol that the body needs, of steroids that the body needs. Therefore, the beauty of Crenessity is that I don't need to use higher dose. I just need to use the dose that the body, or closer to the dose that the body needs to function normally. It still is a little bit higher in the studies that we show, but some people were able to achieve what we call physiologic. That means what we really need, or what our body usually produces to be functioning normally.
Thank you. So, is there any information on trials in kids less than 12 years old?
Yes, the trial that I presented, that included a good number of kids who were 4 years to 12 years. I mean, many of them were 12 to 17, but they were all the ages between 4 and 17 were representing the study. Yes, and the study already had 4 years old, and the results were very similar among all of them. When they divided groups by age, the response was excellent in all of them. That's the reason why 4 years is the age that is approved by the FDA.
Thank you. How soon can a patient reduce hydrocortisone?
1 month. Then we start the medication because people are so excited about reducing the dose. We schedule the blood test in a month, and in a month, if the levels of 17-OHP and or androstenedione are lower, then we start decreasing the dose. However, that's because people are excited about decreasing the dose. Then what I tell people is we can wait the 3 months or 4 months that I see you every 3 months. We can wait 3 months and we do the levels next time. And I mean, you already have been on this dose for years. Then I'm not in a rush to decrease the dose, but people are so excited about the new medication, about the idea of being able to go down in the dose, that everyone wants to do the levels 1 month after starting the medication.
I've heard that many times.
Yes.
Does Crenessity contain the same ingredients that weaken bones?
No, because Crenessity is just a medication that blocks the CRF1 receptor. Then it's a medication that is specific to go into that part of the pituitary gland and block. It's called allosterically that receptor, but it's very specific for that. It's not a steroid. It's just a molecule that does that. That's it. Specific blocking that receptor or binding to that receptor is a allosteric blocking. It's not really a no, doesn't have steroid, doesn't have any other actions in the body that we know of.
Thank you. Here's another great question. Do I need to change my stress dose while taking Crenessity?
Yes, but you need to wait until you get the new change of the dose. Then, for example, if I have a patient on 10, 5, and 5, I usually it's the opposite, 7.5, 5, and 10 or 15. What I do is I change the regimen. I like to do the higher dose at night. That's my personal style to do things. Then I go to 10 or 7.5, 5, and 5. And because I decrease the dose, then the stress dose is going to be decreased. I tend to double the dose. And always Q8 when it's a mild condition. I do every 6 hours when it's a severe condition. But because I was able to decrease the total dose, then I'm going to decrease the stress dose accordingly. But I always need to be sure that the dose needs to be above certain amount. Because if you get so excited, now I was able to decrease the dose a lot. If you double the dose, you're not going to be able to reach the levels that the body needs for a stress dose. But yes, you decrease the dose of a stress dose. You change your stress dosage regimen.
So just to clarify, that's going to be different for every patient, right?
Correct. And it's according to the dose. The new dose of the patient is going to make the new style, the new regimen of stress dose, because it's based on the dose. Then I double the dose or triple the dose, but I tend to adjust to make it easier to people not to make so many changes. I try to make it more standard.
So this has been fantastic. We've had some great questions. And thank you, Dr. Diaz, for your patience in answering all of those questions. We want to thank everyone who participated. Once again, thank you to Dr. Diaz. Thank you to Paige for sharing the information on the Access program. And special thanks to all of you for joining us today. If you want more information on Crenessity and hear directly from patients and their families about their experience with Crenessity, please scan the QR code. You can also go to crenessity.com to get more information. There's information there for patients, caregivers, and also for medical providers.
Approved uses. Crenessity crinecerfont is a prescription medicine used together with glucocorticoids, steroids, to control androgen, testosterone-like hormone levels in adults and children 4 years of age and older with classic congenital adrenal hyperplasia, CAH. Important safety information. Do not take Crenessity if you are allergic to crinecerfont or any of the ingredients in Crenessity. Crenessity may cause serious side effects, including allergic reactions. Symptoms of an allergic reaction include tightness of the throat, trouble breathing or swallowing, swelling of the lips, tongue, or face, and rash. If you have an allergic reaction to Crenessity, get emergency medical help right away and stop taking Crenessity. Risk of sudden adrenal insufficiency or adrenal crisis with too little glucocorticoid steroid medicine. Sudden adrenal insufficiency or adrenal crisis can happen in people with congenital adrenal hyperplasia who are not taking enough glucocorticoid steroid medicine. You should continue taking your glucocorticoid steroid medicine during treatment with Crenessity. Certain conditions such as infection, severe injury, or shock may increase your risk for sudden adrenal insufficiency or adrenal crisis. Tell your healthcare provider if you get a severe injury, infection, illness, or have planned surgery during treatment. Your healthcare provider may need to change your dose of glucocorticoid steroid medicine. Before taking Crenessity, tell your healthcare provider about all your medical conditions, including if you are pregnant or plan to become pregnant, or are breastfeeding or plan to breastfeed. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. The most common side effects of Crenessity in adults include tiredness, headache, dizziness, joint pain, back pain, decreased appetite, and muscle pain. The most common side effects of Crenessity in children include headache, stomach pain, tiredness, nasal congestion, and nosebleeds. These are not all the possible side effects of Crenessity. Call your healthcare provider for medical advice about side effects. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit MedWatch at www.fda.gov/medwatch or call 1-800-FDA-1088. Dosage forms and strength. Crenessity is available in 50 milligram and 100 milligram capsules and as an oral solution of 50 milligrams per milliliter. Please see full prescribing information at www.neurocrine.com/CrenessityPPI.